Imagine kapag nagkakaroon ka ng weight gain, nagkakaroon tayo ng deposit sa ating katawan. Imagine mo, ganun din na nangyayari sa ating liver.
Hello everyone, my name is Samantha Pervor, welcoming you to this year's first episode of Let's Talk Wellness with Watsons. Sabi nga nila, New Year, New Me. It's the perfect time to make resolutions for our health. And of course, dapat hindi natin makalimutan ang liver health natin. It is responsible for filtering out toxins from our body, among the other vital functions. Napaka-importante talaga nito. That's why we're gonna learn about it all today. But before we get going, remember to follow us on Facebook, Instagram, and TikTok. And do subscribe to our YouTube channel for more health tips. Our main guest for today is a doctor of internal medicine who's knowledgeable in liver disease prevention. Please help me in welcoming Dr. Mary Jean Ramores. Hello, Doc. Welcome to the show.
Hello, Sam. Hello, everyone.
So, Doc, let's start with the basics now. What exactly is the role of the liver?
The liver is the largest organ in our body. It actually weighs 1 to 1.5 kilogram and it is located in the right upper quadrant of our abdomen. The function of the liver includes regulation of nutrients, production of bile, and metabolism. Pag sinabi natin metabolism, kasama dyan ang drugs and supplements.
Doc, I've heard a lot about the fatty liver disease and how it's become more prevalent right now. Can you tell us more about that?
Fatty liver disease, yan yung nangyayari kapag nagkakaroon ng accumulation ng fat sa ating atay. So meron tayong two types, the non-alcoholic fatty liver at alcoholic liver disease.
So Doc, you mentioned two types, no? Can you tell us more about NAFLD or the non-alcoholic fatty liver disease first?
So ang non-alcoholic fatty liver disease, it is associated with obesity and insulin resistance. Ang nangyayari dito, kapag meron kang fatty deposits, pwedeng magkaroon ng inflammation sa iyong liver na pwedeng mag-cause ng liver cirrhosis or liver cancer.
Wow, Doc, very in-depth naman yung explanation mo ng NAFLD. How about naman yung alcoholic fatty liver disease? Can you tell us about that?
Ang alcoholic fatty liver disease or alcoholic liver disease, yan naman ay nangyayari dahil sa consumption or intake natin ng alcohol. With alcohol kasi, alam naman natin na ito ay hepatotoxic. Kapag sinabi nating hepatotoxic, ibig sabihin, toxin yung alcohol at ito ay pwedeng mag-cause ng damage sa ating liver. With liver damage, pwede tayong magkaroon ng liver cirrhosis and liver cancer.
Doc, are there any particular symptoms that we should watch out for both types of fatty liver?
Having fatty liver, for alcoholic and non-alcoholic, actually wala yung symptoms. Early detection ay important. And of course, abstinence sa alcohol. Siyempre, kasama na rin doon yung healthy lifestyle para ma-prevent natin na magkaroon ng fatty liver.
Okay, so you heard it. It's really important to be sure that you have your checkup so we know that your liver is in tip-top condition. Pero Doc, are there other liver conditions that we should watch out for?
Alam mo, Sam, we have other kinds of liver disease. With liver disease kasi, pwede natin siyang makuha with infection, katulad ng hepatitis A, B, C, D, and E. Also from immune hepatitis, from drug or toxic-induced hepatitis. So, i-expound ko lang yung hepatitis. Kapag hepatitis A and E, nakukuha natin yan fecal-oral route. Kapag sinabi nating fecal-oral route, ibig sabihin, meron tayo na intake na contaminated ng hepatitis A or E. Mape-prevent natin ito with hand washing, sanitation, proper handling ng ating mga pagkain. And also with vaccination. Alam mo ba na may vaccination for hepatitis A? Pagdating naman sa hepatitis B and C, yan naman ay nakukuha natin with the blood. No? Pag sinabi nating blood, pwede yung makuha through injections or na-prick ka ng needle. Pwede rin yung makuha through blood transfusion kung ang blood na isasalin sa'yo ay contaminated with hepatitis B and C. Of course, pwede rin yan maipasa through sex. With sex, mas maganda we practice safe sex and pwede rin siyang maipasa through maternal or mother to child. So para ito ay ma-prevent, mas maganda kung meron tayong vaccine. Ito yung tinatawag natin na hepatitis B vaccine. At mas maganda rin itong ibigay sa mga tao na exposed, like halimbawa yung mga healthcare workers natin or yung mga nasa risky yung kanilang practices.
And Doc, can you tell us about what liver cancer is all about?
Liver cancer is the 6th most common cancer worldwide. And alam mo ba na ito ay second leading cause of cancer-related deaths. With liver cirrhosis naman, you can actually get it from infection like hepatitis B, of course, with fatty liver and alcohol.
So Doc, can you tell us how modern lifestyles have affected our liver health?
Alam mo, with sedentary lifestyle, syempre hindi tayo masyado gumagalaw. So, andon ang risk na magkaroon tayo ng weight gain. Imagine, kapag nagkakaroon ka ng weight gain, nagkakaroon tayo ng deposit sa ating katawan, katulad ng fats, pumupunta sa ating bilbil, nagkakaroon tayo ng double chin. Imagine mo, ganun din na nangyari sa ating liver. Nagkakaroon ng accumulation ng fat sa ating liver, and inflammation can cause liver damage na pwedeng mag-lead sa liver cirrhosis or liver cancer. I-add mo pa kung may intake ka pa ng alcohol. So it can also add sa damage na meron sa ating liver.
And Doc, what's your take on stress and also lack of sleep? Does it affect a healthy liver?
Alam mo ba na merong journal from Endocrinology Society na nagsasabi na kapag ikaw ay kulang sa tulog, you're at risk to have fatty liver because pwede kang magkaroon ng obesity.
And this time around, Doc, how exactly do we become more proactive in protecting our liver?
So, ito yung tips na pwede nating ibigay. Number 1 is exercise. Alam mo, makakatulong kapag meron tayong 150 minutes of exercise per week. Pero pwede mo naman siyang i-divide. Like halimbawa, 30 minutes lang per day for 5 days. And then, next one is the diet. Of course, diet talaga. Kailangan good choice ng ating pagkain. And then, avoidance ng alcohol intake. Kung kaya nating i-limit or kung pwedeng wala, abstinence, mas maganda. And then, the last one is the vaccination. Meron tayong mga sakit na pwede mag-cause ng liver damage na kaya namang i-prevent like hepatitis B and hepatitis A.
Doc, I read somewhere, how accurate is it or how true is it that liver damage can be reversible? Can you tell us about that?
Alam mo, depende yan. Kung ang problem is fatty liver, pwede pa natin yan magawa ng paraan. With proper exercise and diet, pwedeng mawala din or matanggal natin yung fatty accumulation sa ating liver. However, kapag nag-progress na ito with liver cirrhosis, yan na yung irreversible.
And Doc, how about for vitamins and supplementation? How can we improve the health of our liver?
Marami tayong supplements na available sa market. Merong mga phospholipids, meron din tayong mga antioxidants na pwedeng tumulong sa ating liver health. Pero bago kayo mag-take ng any supplementations, mas magandang magpakonsulta muna sa inyong mga doktor.
Alright, so you heard it from Doc. Always consult with your doctors first. Now, Doc, before we wrap up our little discussion here, can you share a few final reminders or takeaways on how we can start caring for our liver better?
Okay, ang kaya nating i-share sa inyo is the tips para ma-prevent natin yung liver damage. So, I'll give you 4. 1 is diet, 2 is exercise, 3 is avoidance or abstinence sa alcohol, and 4 is the vaccination.
Beautifully said, Doc. And I do hope that inspired all of you to take care of your liver and more importantly, add that to your New Year's resolution. Thank you so much, Doc, for joining us here today.
Thank you, Sam.
If we want to stay fit and protected from illness this year, it's important to consider our liver health. And more than exercise, we also have to watch our lifestyle and eating habits. Now, to help us learn more about the liver after our discussion with Doc Mary Jean, we invited our Watson's pharmacist, Diane Renlin Lopez. Hello, Diane. Welcome to the show.
Hi, Sam. Hi, everyone.
Diane, can you share with us which your favorite part was with Doc that really stood out to you?
Actually, lahat po ng information about the discussion is important. But what stood the best for me is about the fatty liver. Ano-ano ba yung mga nagiging causes ng pagkakaroon natin ng alcoholic and non-alcoholic fatty liver diseases, and kung paano natin mamamanage ang mga ganitong condition. As a Watson's pharmacist, it is essential that we know this information so that we can share it to our customers to improve their overall health.
Tama ka dyan, Diane, and thank you so much for sharing your insights with us. Now, since marami tayong bagong natutunan kay Doc kanina about liver health, let's get to know even more by testing our knowledge about certain myths about the liver. We're going to play Liver Legends. I'm going to mention some liver legends, and you are going to help us debunk each and every single one of them. Are you up for the challenge, Diane?
Yes, of course, game.
All right. First liver legend, you only get liver disease if you drink too much alcohol. Sounds convincing, right? But how is this a legend?
It is not true because alcohol is not the only factor that's affecting the liver. Sedentary lifestyle like yung minimal to no exercise and poor choices of food can contribute to fatty liver disease.
Good answer. Okay, next one. Taking paracetamol is always bad for the liver.
That's a legend po, kasi it is actually safe for the liver as long as you take it properly. Kaya it is best that it's prescribed by the doctor.
And finally, Diane, if your skin hasn't turned yellow, you don't have liver disease.
That's not true po. Yellowish skin or jaundice is not the only symptom of liver disease. That's why it is important to consult your doctor regularly.
All three legends perfectly debunked. Good job, Diane. And of course, thank you so much for joining us here for today.
Thank you, Sam, for inviting me.
Taking good care of your liver now is one of the best resolutions that you can have for yourself this year. And to help you nurture your liver with love, Watsons has comprehensive supplements and medicines that are available through the Watsons app and at 1,100 plus stores nationwide.
For more information about medicines, supplements, and health equipment, don't hesitate to ask your Watsons pharmacist.
Beginning your liver care journey shouldn't be a challenging resolution for 2025 when you have the essentials you need right within reach, thanks to Watsons. Essentiale Forte capsules contained de-oiled and rich phospholipids from soybeans that provide nutritional support for managing chronic liver disease, liver cirrhosis, fatty liver, and intoxication by hepatotoxic substances. Ampalaya Plus capsules contain ampalaya and more nutritional herbs like yellow ginger for fighting oxidative stress that may affect liver health. Watsons B Complex contains essential B vitamins that support neuromuscular and liver function. Pharax B Complex contains B1, B6, and B12 that are known to help with non-alcoholic fatty liver disease as well as neuropathic symptoms. Neurobion is packed with B vitamins that effectively nourish nerves and provide support for post-surgery nerve and liver strain. ProNerve capsules also contain vitamin B1, B6, and B12 that are essential for the treatment of vitamin B deficiencies. At Watsons, we have comprehensive supplements, vitamins, and medicines that are available via the Watsons app and at 1,100 plus stores nationwide. I'm Samantha Purvor, inviting you to start nurturing your liver with love.